I think that we are ready if Dr. Dominic Bosse is ready for us. And I'm just going to do a brief intro, and just forgive me for 1 minute while I find it. And I hope that you don't mind, but I'm going to kind of cut it short. I know it's awkward for me, and
Go
sometimes it's
ahead.
awkward for the
Go ahead.
medical ones. So, but I just wanted to let everyone know that you are a medical oncologist specializing in kidney and I always struggle with this word, genitourinary cancers.
Great.
And you are at the Ottawa Hospital in Ontario and the University of Ottawa. And I know you are well loved by your patients, because anyone that we talk to through our coffee chats or peer support always mention how appreciative they are of you and your care and the attention that you offer to your patients. It's really does make a difference. So we're so grateful for you to be here today. And you're going to talk about a systemic therapy decision guide that we've been working on for a while now. And if I may, this is one of the projects that an unnamed pharma started with us. They are very interested and engaged and enthusiastic about making sure that patients have the information that they need when they talk to their medical professionals. So I'm going to leave it at that. We are very grateful for their support, and I'm going to hand it over to Dr. Bosse. Thank you so much.
Thanks so much, Christine, for the very kind introduction. And obviously, it's quite a delight and a pleasure to be part of this forum, because how important they are. Having this mixed table between patient, stakeholder, and physician is really a unique opportunity. And thanks also to underscoring like how brilliant Dr. Kapoor has been to Canadian across the world. Kidney cancer patient across the world, but specifically our Canadian patient and the whole community really he's been mentor to all of us. So
Yes.
It's a very nice and moving that you took some time to highlight like what he's done in his career. And I think to some extent he would have been great supporter of the project we are presenting together today, because really translating complicated concept to the bedside, empowering patient to get the care they deserve has always been something very close to him. So it will be it's quite a privilege to be able to present this concept, and also have been working with Dr. Kapoor like in the past, and he stays with us in our heart.
I agree. I think he would be very appreciative and very positive about this effort. Like this would be something that he would really be advocating for. So thank you, and I'll let you go ahead.
Yes, very good. So I'm going to share my screen. So you'll see it looks a little bit different to what you used to see when I share my screen, because that's a PDF. It's wanted because this is the tool we want to present you, and I want you to have a 50 feet eye kind of like overview of what it is, and then we'll zoom in and dive in together so that we can actually understand more. So the tool is very brief in a way, but that's what we want. Okay, we don't want to overwhelm patient and stakeholder, caregiver, and others with a 10-pager, right? This is not time to get dizzy with information. It's time to get organized and having clear mind about what's going on in the question that you may want to ask to your doctor. Okay, so it's a 2-pager alone. Okay, and so really what it is, I'm going to zoom in now that you've seen it. Give me a second there. All right. So what the guide is really a guide to discussion. And I was chatting with Christine and other stakeholder, trying to understand how is it supposed to complement a consultation with a physician, right? And what Kristen was telling me is that, Dominic, there's a lot of all patients are different, but also all doctors are different. Like how you present information, the amount of information you decide on asking, it can vary from a doctor to another. And so this guide is intended to a bit level the ground there, to give the vocabulary to the patients and their caregiver, to know actually what to ask if the physician has not bring this forward by themselves, but also it's filled up with, clues and, cue information that, like, that people want to, may want to get familiarized with before their next meeting with their physician, right? So that they can have the right questions or think about new questions that they didn't know was important for them, but because they've read it there, they now want to inquire about it and want to know the answer to. Okay, so this guide will be widely available, and I'm sure Kristen will be instrumental in the delivery of those documents. It's obviously free, and it's divided in 4 sections. So the first section is about, systemic therapy, right? So for advanced kidney cancer, so again, this is intended for people with stage 4 metastatic kidney cancer, not for the adjuvant discussion or things like that, okay? Systemic therapy options include targeted therapy, immunotherapy, or combination of these. Some systemic therapies can be taken in tablet form at home, while others are given intravenously. So meaning by way of a vein, at a cancer center or infusion clinic. So the below questions can be helpful as you learn more about your medical team and your treatment option, right? Because when you get diagnosed with cancer, then you're like, okay, I'm gonna get chemotherapy. And then that's not always true. Actually, it's often not true. Okay. And in kidney cancer, it's usually not true most of the time. Okay. So when we say systemic therapy, it's just a way to say, well, we have tools, we have like, IVs and we have pills. And this contrasts with receipt of a surgery or receipt of radiation therapy. Okay. So these are the 3 main domains. You have like surgical oncology, radiation oncology, and medical oncology. And medical oncologists, like I am, we give treatment that we call so-called systemic therapy, and these can be pills or IV. Okay, and not every pill and IV are chemotherapy, and not every IV is an immunotherapy either. So we kind of need to understand this. Okay, and so those questions are mostly geared towards like shedding clarification there, shedding light on these mysteries there. So first question you may want to ask, like, what's the role of my medical oncologist, and why is everybody oncologist around me? I just talked to a surgeon oncologist, a uro-oncologist, about removing my kidney versus not. I'm meeting you, a medical oncologist, and tomorrow I have an appointment with a radiation oncologist. So who's my quarterback? Okay, so that's what it comes down to. Who's going to guide me through treatment, and why am I meeting all of these guys? Okay, and so this is a very important question so that you understand the trajectory of your care. Okay, and the second question: who else make up my medical team? Who is my main point of contact for concerns, for questions, right? So there's a doctors with 3 type of oncologists. One of them usually is the quarterback, and then there's a whole slew of other people around, right? You're meeting nurses, you're meeting like, physiotherapists, sometimes you're meeting like social worker, you're meeting like lots of people. There's the nurses in the clinic, there's the nurses over in the infusion center, there's like lots of many stakeholder. And then we give you like information, like stack of information usually. But what you want to know is that who can I talk to that understand my disease, that I understand where I am, and how can I reach them, right? So usually most cancer center will have a way for you to communicate your concern, and typically it's not directly to your doctor, because the doctors are just one individual, and so it's better to bring your concern to a team, and the team will ask your doctor. But if your doctor is not there, you don't want to wait. You want to have other doctors that can help you while your own doctor is away, right? So usually there's a patient support line or like a hotline or something you can reach. So when you meet your doctor, you need to leave that meeting, that consultation, with an actual number or somewhere to write or to call if you have issue. Okay. And the third question is like, what does the type, subtype, and stage of my cancer mean for my treatment? Okay. So there's a lot of different flavor in kidney cancer, okay? The main flavor, I call it, is the clear cell renal cell carcinoma, okay? When you read about kidney cancer, most of the time you're reading about this, that you know it or not. But then there's rare subset, okay? The other flavor that was not as common, okay? So these very rare subsets sometimes have nuances as to how you're gonna approach a treatment. May also impact prognosis, may impact lots of things, okay? So this is why sometimes you want to clarify it. If I'm reading on internet on my kidney cancer, like what type of kidney cancer do I have? Because that matters, right? And in this stage is a very difficult concept to grasp, right? Because people are all being said, you have metastatic cancer, and they're okay with it until they discovered stage 4. But really, like, all of these things means the same thing. You know, people are okay with getting systemic therapy, but then they're devastated when they hear they're stage 4. But again, it's all the same thing. So you need to understand where you're at, right? Because there's multiple ways to say the same thing, and that leads to tremendous confusion. Okay. So when a cancer is not operable, usually most of the time, it may mean that it's stage 4. Okay. Because you can't remove it with a surgery. All right. So you need to understand that. And that is the equivalent also of being like advanced slash metastatic. And then there's people for whom you can remove that cancer. So usually they are not stage 4. Okay. And there's all the gray shades in between of this, where your medical team is trying to do all they can to investigate, to clarify, and to make sure that the information you've been given is accurate. And sometimes they will start treatment and they'll ask for investigation at the same time, and then they will bring you clarification down the road. So this question is important for that reason, okay? Why is systemic therapy recommended for me? Why is it different than chemotherapy? All right. So so that's a very important question, because people often just start systemic therapy, like, with me, for instance, for a few cycles, and like coming back to Dominic, why you just take it out? How about you just take it out? Right? I got a mass there and a mass there. Take them out, and then we don't talk about it anymore. And so you need to understand, why is it that the recommendation was to take pill or receive IV, as opposed to getting a resection, right? And usually the answer is that systemic therapy goes everywhere in the body, versus a resection with a uro-oncologist, for instance, or a surgical oncologist, or radiation is more kind of a local therapy. So you need to see something to remove it. The problem with those cancers is sometimes there's what you can see, and there is what you cannot see. And when you take a treatment that goes everywhere, it does address what you see and what you don't see. But when you take more localized therapy, like surgery or radiation, then yes, it'll take care of what you can see, but leave behind what you cannot see. And so once you understand this concept, it makes more sense to take a pill every day, or to go and get an infusion every 3 weeks, because you're not only targeting what you see, but also what you cannot see. And that's the reason why you're doing this. Okay. So that's an important clarification, but that can bring lots of sense of what you're doing. So that's an important question. And then what are the differences between targeted therapies and immunotherapies? Because if you start reading on the internet, you'll see there's upward of 15 different treatments for kidney cancer. Why is it that you're deciding on one? Okay. And really, this guide is not meant to be a second opinion document that's going to tell you the truth, and then using that guide, you can replace your doctor and make sure your doctor is on track. Usually your local physician is aware of all the treatment option, and they come down to one option because they believe is in your best interest. But it doesn't hurt to ask, right? It's easy to answer as well. So there's tons of pills. There's many different pills. Some of them approved by the government, those are not. Some have been proven efficacious in a certain setting, those has not. Those have others have not. I mean, there's some IV that were demonstrated efficacious in in one setting, but not in the other one. Some IV are available elsewhere, but not here. Some are available here, but not elsewhere. So it's a very complex situation. This is what it brings some frustration, because when you read on the internet, you see all of these names, and how could you make sure you're receiving the right one? Well, I think you should rely on your physician for that, but then asking, hey, how do you come down to that anyways? Right? Why am I getting this axitinib plus pembrolizumab, or this cabozantinib, or this ipilimumab and nivolumab? Why are you thinking of this, right? So that will give you trust and confidence about the plan, right? If your doctor tells you that he's thinking about it and there's reason for him to favor, and sometimes there's no reason to favor one or the other, and your physician will be involving you. Will say, you know what, we had 2 or 3 great options there. I see small difference, okay, in those options. What do you think you prefer for yourself? And then you can choose, knowing that they're all good options, right? So this is what that type of question can bring on the table for you, okay? Then moving on to the other section, understanding treatment options, okay? So whether you're starting or continuing a systemic therapy, there are important questions to ask that can be determined, that can determine your treatment path, depending on where you live in Canada, your health insurance coverage, and the current recommended guidelines for approved treatments. The below questions can prompt discussion about the treatment path your doctor is recommending and why it's the best options for you at this point in your care. So that's a bit of the segue of the last question, the first part, right? So first question there, what treatment are available covered by my provincial health insurance, and how do I get access? Will I have to pay for the drugs? Okay, this is just to prepare you to be able to maneuver the system, because yes, the system is not perfect and it needs to be maneuvered. And in Canada, we have like different provinces. Healthcare is provincial, so there's like as many ways as there's provinces to deal with healthcare. Okay, and one of the key point is to make sure that you can access the treatment. So first of all, what do you recommend to me? And second of all, do I need to do anything to access the treatment you want me to receive? And usually the doctor will prime you. Will say, well, you know what? I'd like to use this treatment, but we need to make sure you have private insurance, or we need to make sure that we apply and get an EEP from the government and do this and that. Or they can warn you, there's going to be a bit of a delay there because we need the authorization from this funding agency and whatnot. Okay, so it really comes down to that. I mean, ultimately, we have to work with the system that we have, but if you're well informed, you can take this step. For instance, in Ontario, if you're less than 65, more than 25, and you don't have private coverage, all pills, whether they're cancer pill or they're common pill for blood pressure, things like that, are not being covered by ODB, the Ontario Drug Benefit. And in other province, that's different. Well, if you know this, you can get like Trillium insurance and be ready for Trillium to take over the cost of your PO medication, your oral medication. But the IVs, though, in Ontario are covered. So again, there's nothing we can do to change that today or the day of your treatment. And we can argue if it's right or wrong, but that's the system we're living in. And so we just need awareness to make sure we're prepared, okay, to take action. Because the last thing we want to do here is induce delay. Because when you have a recommendation for treatment, it could be your physician ask you to start ASAP. That means that we don't have time for undue delay. So being on the top and making sure you have the coverage you need and how to access coverage will be important. Second question, what treatment is the best options for me and why? Will it give me a better quality of life, more time, shrink my tumor? So again, it's a bit of an overlapping question with what's been said before, but here there's a bit of a different nuance. You're basically trying to see what's important for my doctor, is it the same thing that is important for me? Well, if your doctor is giving you a treatment that, makes you believe it, that's the thing that will make you live as long as possible, but you don't actually care about that. Because for you, you're like, well, my longevity is not as important as my quality of life. I want my trajectory, how I get there, to be as nice as possible. And for me, taking a pill every day is not a life, or for me, taking IV is not a life, or for me, what I really, really, really think is important is I want to see those tumors shrinking, for instance. Like there could be something that is more important for you that your physician has missed or didn't understand well. So this question kind of prepare you to say, well, do all my goal aligning on my doctor's goal, right? And usually most physicians will align their own goal on yours. So they will ask you question, but again, not all physicians are made equal. So this question will help you to make sure that you have the same agenda there, that you're working towards the same goal. Third question: does the treatment you are recommending now make me ineligible to receive other treatment in the future? Okay. It's really like a question about expectation, right? Because the funding agency usually have an algorithm of like, well, if you get treatment A and B, then you cannot access Z and Y, and there's a different like funding game there to understand. And in situation where you go through lines of therapy and then your doctor say, well, now I have nothing left to offer you. And you'll know there's other people getting different treatment. Maybe they access it, via the private insurance or things like that, or clinical trial, right? And so this is a bit of the question to really like, manage expectation up front. If I use this type of treatment, I'm gonna have 2 options. Or if I start with that other type of treatment, I'm going to get 3 options, 3 lines of therapy. Okay. And that segues away well in the 4th question. Like, what is it anyways? First line, second line, third line, right? What does it mean? Usually it means that you start with a treatment, and if there is progression or intolerance of that treatment, so progression of the cancer, meaning the cancer therapy is no longer working, whether it worked before and no longer works, or whether it never worked, if it's not doing the job it's supposed to do, you don't want to be on it because you have side effects. You don't want that. You don't want to have side effects and no benefit. This is not a win-win. So if it's not working, then your physician will tell you, well, now we need to move on with a different tool. That's going to be the second line of therapy. And if that second line of therapy works, good. If it stopped working, then you have to move to the third line. If there is a third line, okay, so sometimes you may not be able to access the third line. Okay, so this is the type of question you may want to bring forward. I don't know that is the greatest question to ask upfront, because it's a lot to process, especially when you're dealing just with the diagnosis. It's already overwhelming. So understanding these nuances, like could be even more, but then asking early enough so that you don't have surprise could be helpful, right? And then the 5th question here is like, what happens if my current treatment fails? What are my other options? Again, it's a different way to phrase the previous question. Essentially, like, hey, if it's not working, what do we do then? Right? Do you know what to do? Do we have a plan here? And your physician will tell you, yes, I have more tools. Don't worry. But at some point, when they're going to start you on the last line of therapy they know they have access to, they'll tell you, I really, really hope that's going to work, because after that, I may not have additional options, right? So when you hear your physician say, well, I do have tools after that, that's really reassuring. That gives you confidence. When you hear your physician say, well, we may not have an additional line of therapy, then it's also a cue that, well, we need to prepare ourselves to every eventuality here, right? We need to be ready that it's possible we won't have additional line of treatment, which is very, very important so that you can prepare yourself. Okay. So that's the first page. So unless there's something burning, and then please, Kristen, interrupt me. If that's the case, I can move on to that second page, and then we can open the floor for questions. But if there's something that people want to ask, clarify, then I'm more than happy to break here and answer those questions.
That might be a great suggestion, Dr. Bosse. Is there a question from the audience? This has been a jam-packed session so far. There's a lot of information here to take in, but it also highlights what a great opportunity this is to have this decision guide to when you talk to your doctor. And we're so overwhelmed as patients when we get that diagnosis that this is going to be helpful to put our thoughts in order to know what we need to ask. So if we have a question from the audience, I do want to touch myself on one point that you've just recently made, that sometimes does come to the end when there are no treatments available, but there are still things available to you. And this is going to be a full webinar for Kidney Cancer Canada in the new year 2024, just to let you know that we are thinking ahead, we are planning for this, and that's called palliative care. And palliative care has a very the connotation of palliative care is kind of threatening for patients, like they don't want to hear it. But please trust me that palliative care doesn't necessarily mean it's all over. It means there's lots of therapies and support for patients when they get to that point that will help them psychologically, with pain management, with nutrition, all those things that are important to support our patients' quality of life as as they go forward on their care path. So I just wanted to bring that up. It is a frightening situation for a lot of patients, but thank you for being brave and bringing that up and honest with our community. So I'm not seeing questions right away. I think they're just kind of absorbing
There's
what
been a
you've
lot.
said. So
For sure, but I think that's an
what?
excellent point, Kristen, you're bringing, and definitely thank you for clarifying. When I say that there's no more lines of therapy, really it pertains to pills and IV.
Exactly.
But you're not you're not alone from there. And in fact, yes, these are a very difficult discussion to approach, and depending you as your physician and who you are as a person, who's your family, all of our temper, characters, personalities, there's no one discussion that's the same, and there's no one good way to receive that information. But one clarification I'd like to bring with palliative care is really that palliative care start the first day you start your treatment.
Yes, thank you.
Because there's two ways to treat. There's the curative intent. This is when your surgeon says, well, I got it all out, and hopefully it's not coming back. We'll cross our finger.
Yeah.
And there's when it's too late, we're advanced stage.
Yeah.
Metastatic, where we can still have very, very nice surprise. And sometimes the cancer, goes away for a very, very long time. But we can't plan for that, unfortunately, not yet. And so the intent of that treatment is palliative.
Yes.
It's to bring quality of life. It's to bring time. It's to help to plan your life, right?
Yes.
And this is all palliative, yet very satisfying if you took those treatment and it's working for you. It gives you hope.
It does.
It helps you live longer, right? And the palliative care without the systemic therapy is just the continuum, as you explained it. We're going to do all treatment we can to improve quality of life and improve survival. We're not necessarily hoping that things go quick when we talk about palliative care. No, it's the opposite. We want things to go smooth, well, and we want people to stay with their family and the loved one for as long as possible. And when you take care of symptoms, like palliative care doctors do, this is what happened, right? So that's why you need to be well surrounded and have the right question. Ask the right question, because there's tools.
There are, and they're part of the team all the way through, as you mentioned, that, like you're having some difficulty with pain management, your oncologist is going to help you as much as they can, but palliative care also can help you. So you work in conjunction with each other. And I think a lot of patients aren't aware of that possibility. So thank you so much for bringing it up. I'll just check in with Mona. Mona, do we have a question, or are we good for right now?
There is a question. It is they're wondering if there's a flow chart about the drug lines.
There is, not in my presentation, but I know Dr. Kenil is presenting later on. I wouldn't be surprised if she has some sort of guide there. And yes, there's like, they're different by province, right? Like,
Yes.
I mean, I can talk more easily about the Ontario one because that's the one I'm working with every day. And again, sometimes like, planning too much down the road does not always pay off.
Mm-hmm.
Being aware of down the road is important because knowing your options and knowledge is power. But sometimes we just need to think about the present time. You're coming in the clinic, you have symptoms from your cancer. How can I get better and better quick? Is a more relevant question than sometimes, oh, well, what's the best sequence of things? Because obviously your doctor will try to give you the best sequence of treatment, but your best sequence may be different than somebody else based on the disease characteristics, or what type of cancer, what subtype of cancer, your symptoms and things like that. Mm-hmm. So like our brain is like a computer, a model that does a model, right? We look at things, at everything, we sum it up and we come up with, well, you know what? I think this trajectory, this flow chart is superior for that person than this other flow chart. Right. And sometimes, unfortunately, the best flow chart is not available because of funding, because of politics and things like that. But I must say that, in general, like, we're doing good in Canada compared to many different countries. Yes. And no, it's not perfect. But again, I think when we compare ourselves, like, we're still lucky to have access to a great deal of like different regimens. So I think, so I would not be too worried about this because we don't have tons of leverage. I mean, as a community, we have leverage, but at the individual basis, when you hit the doctor's office, sometimes, you can't change politics just like that, right? So I would not focus and waste my, your precious, not time, but like feelings, right? Because it's frustrating, mm-hmm. right? I think in general, like, there's many good ways to treat in Canada. And as a community, as Kidney Cancer Canada, like, we need to lobby and push the governments to give us what we think we need. Okay, but mm-hmm. it's the organization type of strategy. It's not like a one-on-one, right? Because right. Otherwise you feel quite alone in that battle. And that's what Dr. Kapoor and many of us in the country, with the great voice of Christine and Mona and everybody else, are trying to do, like, every day, right? Changing the landscape to have more and more access. Okay,
through our advocacy. Yeah, you brought up really good points. It's unfortunate that they're not the same through the provinces. We are working on an algorithm, like what the question related to, but it is quite a process, as you mentioned, because it's so different in each province. So that's something we're working on. We hope to have it for the future, but it's also changing. It changes, as drugs come, and it changes. So thank you for touching on that point, and thanks for that excellent question. I'll let you proceed, and then we can.
I was planning on moving a bit faster because it's already 45, please. And we have the excellent Wendy coming, and I'm really looking forward to her comments. I don't want to take too much of her time, so I'm going to skip quite a bit here. So the about systemic therapy. So basically here, there's different type of treatment you can get. And different ways to take them. We say by mouth, orally, or IV, and they all have different side effects and different profiles. Okay, so essentially, I mean, dose and schedule and things like that. So essentially, those questions are there to prepare you for this. Okay, Okay, perfect. Sorry, I'm lost in my 2-pager. Okay, now we go. Okay. So how can I prepare for treatment? Are there lifestyle changes you recommend? Like, oh, can I still go to the gym? Oh, I like to swim. Can I swim? Oh, how does that affect my sexual life? Oh, all of these questions. Can I eat everything? Like, these are questions that often patients have, right? So this just reminds you, okay, you know what? Did you have questions along that line? It's a good time to ask. Do you want to ask like during your first consultation with a physician? Maybe, maybe not. You're going to see a physician quite a bit. I see my patient like, every month. So maybe the third month, that's going to be a question you have, but you still have that document. Maybe that's the good time to make like a check mark there and ask, right? What are the potential side effects of treatment and how do they manage? How are they managed? So this is important to be clarified in your first consultation, and that will be clarified by your physician and the nurses that's going to, see you. Okay, but you need to make sure that you have a few items to watch for. Like if you try to learn all the side effects of all the medication, I can tell you it's not going to work well. There's too many of them. Okay, usually your physician is skilled to dilute things out, to filter out the noise, just to have you go home with key points, and then we can rely on document to refresh your memory, right? What should I look out for in terms of side effects? When should I contact my doctor? Okay, I know I can get side effects, but if it's expected, why should I call? Well, we expect people to have side effects, but there's only so much, you should have, because otherwise you get sick, right? And so this is to define what's the threshold. Well, you know what? You're getting immunotherapy, you have 1 diarrhea, it's okay. People have diarrhea. You're having 6, 7, 10 diarrhea a day all of a sudden, that's not okay. I want to call today, right? And so we'll tell you, you go to emerge or you call and what you should do, okay? So make sure you know what to do if something arises. Can my dose be adjusted and or reduced if I experience side effects? Okay, so this is just to remind you that, putting up with side effects is not always the way to go. It is possible that you have more side effects than desired. And there's things we can do about it. Okay, we can stop. It's fine. It's fine to stop the drug for a little bit. We can reduce the amount of drug you're taking because maybe you absorb too much, right? You take a pill. If I take the pill, you take the pill, it's not the same effect because we're a different person. So it may be that your doctor has to adjust things and they're trained for that. Okay, so it's okay to report your side effects so that we can adjust things. It's not okay to hide your side effects and put up with them and get sick because it's not going to work out. Okay, thinking about running full speed a marathon never work. Never. Maybe you can do it for 5 kilometers, but you will not do it for 41 kilometers. You're gonna have to slow down and take your pace. So sometimes you say, I have too much side effects right now. This is not sustainable. Something's got to give. And your physician will say, well, I hear you. Here's my plan. Okay, you take 1 week break and then we do this and that instead. Okay, it's okay. Can I take break or adjust the dosing? So I think we've been through that. Can I adjust my schedule based on the important life event? Say, well, you know what? Every day I take my pill, I have diarrhea, but now I'm going to this wedding. I don't want to plan for a bathroom around me. I want to have my full focus on the wedding of my daughter. This is the other most important thing for me now. Okay? Yes, that. Talk to your doctor. Okay? We can say, well, you know what? We're going to go on a break. I think it's safe to do a break at this point in your treatment. Let's do it. You do your wedding. You come back to see me. We'll resume treatment. Okay, or I'll tell you when to resume. Okay, so married to a treatment plan, things can change, and the old goal of the treatment plan is actually to have you do these things. So don't lose sight of that. Okay, so talk about it. If my dose is adjusted, does it impact the effectiveness of my treatment? So often the timing is as the essence, but when things are working, usually you have a time on your favor. Okay, so ask your doctor, is going to advise you. Okay, and again, speeding up to the last the monitoring and the follow-up. All right. So lots of people go home and then they're having their plan. Okay, I'm going to take that pill twice a day, and I'm getting treatment every 3 weeks and things like that. But then, how long am I going to do that for? Right? How are you even knowing it's working? Right? So these are the questions that I was trying to clarify that. So first question, what does monitoring entail? Why is it important? Okay, well, it's important because you want to know if it's working. If it's not working, the last thing you want to get is cancer treatment. We need to move to second line, right? And so there's various ways to monitor efficacy. Often there's radiographic way. So we have a 2 centimeter mass that shrinks down to 1.5 centimeter. That means it's shrinking, so it's good. Or it stays the same, whereas before it was growing, so that's good. There's a clinical way. Are you doing better? I was having pain to my flank. Since I started treatment 2 weeks ago, the pain has come down. I've stopped taking my pain medication. Well, maybe it's working, right? And there's blood work. Sometimes we look at things. I used to have anemia before my cancer was diagnosed. Since I started treatment, I no longer have anemia. Well, maybe the cancer is getting better. That's why you no longer have anemia, right? So your doctor is going to help you and to understand that. And so then it goes on in the other questions, like the third question, because went to the second one. So what's the timing like of those images, those CT scan, MRIs, and bone scan? Well, the minimum we do CT scan the chest, abdo, pelvis. Sometimes we need MRI and bone scan, but not often. Okay, and we do repeat them at a set interval, usually 12 to 12 weeks, 8 to 12 weeks per them. So if things are good, there's no need to get more than every 12 weeks. But maybe we get a CT scan that was ambiguous, and your doctor's wanting seek clarification. So maybe he's going or she's going to ask a 6 week or 8 weeks interval just because they want to know faster to clarify the ambiguity of the previous CT scan. Okay, it's not always bad. It doesn't mean because you do it faster that we're more worried. It just means that we seek clarity faster. Okay, and then we can very much go back to every 12 weeks. Okay, if you do it too often, you're not able to understand the trajectory of the cancer, and you may take rash decision like, oh, well, it's progressing. Well, it's not. You need some time for the cancer therapy to work. Okay, so every 3 weeks, every 3 months, usually is just enough. Okay, how is progressing defined at this stage? Is there a spread, growth, and things like that? So that's that's how your medical oncologist is going to translate the your radiologist report. Okay, sometimes you read the report because you get it in my chart and you're very scared because the radiologist uses some adjective like frame progression. But then your medical oncologist is pretty happy about the report because they don't believe it's a frame progression, right? So it's important to hit pause when you have a push notification saying you have a CT scan result. You read this and then you're upside down. It's important to ask your oncologist. Like very commonly, we'll say, you know what? A change of 1 millimeter here and there is not really a thing. Or you know what, in hindsight, maybe that lesion was already there, so it's not a new lesion. And then sometimes they will just come to you, you think your scan is okay, but they will not be happy. Your oncologist will say, well, you know what? I don't like, that there's a new lesion here. And so I propose we take action. So make sure you understand what is the oncologist interpretation of your exams, your investigation, your CT scans, and they will translate that to you. Okay. And lastly, what happens next if my cancer grows? Then is just circle back to the second section where we define the lines of therapy. If it's growing, you don't want to be on it, right? A cancer, there's nothing worse than the cancer treatment that's not working because you get a side effects without the benefit. So you want to move on. Okay, so these are things you're going to discuss with your cancer doctor. So these are very simple questions, but they unpack tons of information. We just talk about like for 40 minutes, and these are seemingly easy questions, but then they trigger lots of discussion, right? So we believe it's a good tool for you to use upfront and as you go, to remember the good questions to ask your doctor and to understand. Okay. So sorry, I went over by 10 minutes.
No, this has been so excellent because you've already answered so many of the questions that people have. Your explanation, I think, is going to be very beneficial to those that are watching today, and for those that will see it on our website after. You really touched base on so many of the concerns that patients have. So thank you so much, Dr. Bossi, that this has been an excellent session. And here's Wendy. She's joined us. Thank you, Wendy, for coming on. Wendy is one of our patient volunteers, and maybe we can get Dr. Bossi. We'll just stop sharing screen right now so everybody can see Wendy. And Mona, if you would join us just in case we have some questions coming in on the chat or question or the question and answer spot. So Wendy, we'll just take a couple of minutes. And if you'd like to share a little bit, you've been an excellent patient advocate for your own care path. You and I have worked together for a long time now, and I'm amazed at how well you do. So maybe you could share a couple of tips and a little bit about your story, if you don't mind.
Well, thanks, Christine, and thank you, Dr. Bossi. First, I have to say this guide is excellent. It kind of condenses everything I've learned over the last 9.5 years. So I was initially diagnosed in 2000, stage 2, kidney cancer. Didn't know it was chromophobe at the time. And then 2014, metastatic stage 4 in many places. So it's been 9.5 years that I've been on. I'm on my 5th line of treatment now, and I'm doing great. Now, I have been told there is 1 line left. So that was interesting when you talked about, what's ahead. But at this point, I don't panic about that anymore. But so everything in this guide really has condensed all of what I've kind of had to find on my own, through, and my oncologist helped me with that and told me in the beginning, you really have to be your own advocate. You have to, try to push for what you want and what you need. But it's really, it really does condense everything. And so I think for a new patient going in, it's excellent. It's also, I think, a good tool for even to go back to as you're going along, because there's many questions here that even my husband went over it with me, and he was saying the same things. Wow, this is perfect. Like, wish we had known to ask it this way. And you talked about your quarterback. So like in section 1, what is the role of your team? And that was always and still is a big thing for me, because not every center has a team as such. So sometimes you have to kind of develop your team yourself as you go along, and who can help you with different things. But no, I just find it excellent. It answers a lot of, it gives you the knowledge to ask the questions and to look into things yourself so you can understand. Yes, it'll be overwhelming at first for a new person probably, but again, you can go back to it and say, okay, well, that must be what that meant. And now I can understand that, or I can ask a little more. So I thank you for it. I think it will be a great tool for patients.
Well, that's certainly really good to hear that, you believe it's a good tool. And certainly with time, I think we'll be having the opportunity to massage it even further. So it's interesting, to hear you. And often I was sharing this with Christine, is like, what's the right time to introduce that tool? Should it be when you meet your medical oncologist for the first time, or should it be, for instance, your surgeon that make a diagnosis initially and say, well, you're gonna go see a medical oncologist, here maybe a tool to help. Obviously it's gonna be available for download, freely, right? So anyone can access anytime. But often, you don't want to get too much information before you get somebody in front of you that can translate it. But also you want to be prepared to meet that person. So that there's a bit of a redundancy here where, what do you think is the best timing to use a tool like that, in your opinion?
I don't know, because it was 14 years between when I saw my surgeon, the urologist, and then the oncologist. I didn't see anyone in the oncology field for that 14 years, of course. And I think that would depend on patients, right? So I think the earlier you would get it, the better. But then, like I said, some patients don't want to know everything, and they don't ask the questions, and they're just fine to go with what the doctor tells them. So I think it's good to give them it and then let the patients you know, those patients like myself, for example, who want to know more and who want to be involved are going to have a tool then to help them. There's always going to be people that won't, they're just going to say, well, you know, what the doctor says is good, and I'm good with that. And I think it's good to do it at both. Like, I don't think there's a definite better play. Definitely, it's going to be too much for someone up front right away. It's like, oh my gosh. I mean, it's scary enough when you're diagnosed.
Yeah.
Then if you're told you're metastatic stage 4, of course, you think, oh, 5 years and that's it. I got to do what I can do in 5 years. But, you know, that's not true, obviously, for everyone anymore. So I think it's at least it's something to have when when you calm down and you say, okay, well, now maybe I can get into this and see what I can find out.
Well said. Thank you.
That's a great point, Wendy. We did have that discussion a little earlier, Dr. Bosse, that we don't want to overwhelm the patients when they first start because you're already overwhelmed. But you also want to give it to them early enough so that they do have the opportunity to ask the questions when they're starting. Like, for example, making that choice on first line. It is an important choice, and it's good to have all the information. One thing that's always been a challenge for us, and I know I'm just going over a little bit, but is to get the medical community to share this kind of information with their patients. And this is one way that we're very grateful for this pharma that is supporting this this project, is they are going to help us get it into the medical offices so that it can be provided on that level to the patients, because we do our best getting it out to our community, but not everybody knows about us yet. So it's really helpful that they would provide it to Dr. Bosse, and then he has the opportunity to share it with his patients and the rest of the oncology community across Canada. So that's a real benefit for us.
Yeah, it'll be key to make sure the distribution and the visibility is there. Otherwise, the tool is not useful if you can't find it. Hopefully, we can come up with, like, you know, little card there with like a QR code or something that, you know, you just hand people. It goes well in their wallet or the pockets of the jeans, and then, you know, when you go home, you can use your phone to download the whole thing, and there'll be different way to access that for a different patient. But we need to be to make noise about it. Otherwise, it's going to be dying on the shelf somewhere, which we don't want.
Yeah, because you go in there and you get your information about your drugs, you get your package, you know, your first treatment, here's your package, and it's all scary. But if there was something with that says, you know what, here, you know, even if you didn't catch on to it at the first, it's there. You always go back and you're looking at side effects and you're looking at the pamphlets for the drugs. So it definitely should be something that we should make noise on to get to patients, because the more awareness you have, the better.
I'd like to mention, I don't know if we said it, but for the French audience, that tool will be available in French as well.
Oh, yes. Yeah. Everything that Kidney Cancer Canada does in English, we do in French across Canada. And I think Mona's my guard dog on that one. I'm sorry, Mona. Didn't think of a better word, but she makes sure that I'm always on target, and I do appreciate that. So it's important for our whole community to get the information that is needed. And we did have a lovely comment in the question and answer by one of our attendees that they are appreciative of this excellent brochure and are going to recommend to patients that they might know to download this and use it as a tool for moving forward in their care path. So I'm afraid we've gone just a couple minutes over. I'm so grateful, Wendy. Thank you so much for being our patient voice on this. And Dr. Bosse, what an excellent presentation. Thank you so much. And now I understand why your patients love you.
You're so kind. Thank you so much for the invite. I very much appreciate and all you do for patients in the community. Thank you.
Thank you. Okay, take care.
Bye.